Hello. Greetings to the past LERA and chapter presidents, academics, neutrals, government officials, management and union representatives, and everyone else who is tuned or dialed in today. I want to thank you all for helping us carry out LERA's 72nd annual meeting in a virtual platform. I hope everyone has been enjoying the other virtual events LERA has hosted. I've been looking forward to this speech for some time now and have been particularly excited about the chance to appear presidential. So I must say it's a bit of a letdown to be wearing my best suit and to be addressing you from my home. But with you all scattered about the various corners of the country in different states and different time zones, I'm going to pretend I am delivering an anxiously awaited, nationally televised address from who else? The president. After all, I am still president. Seriously though, to come back to what is real, this meeting has brought us together at a very challenging time. The tragic events giving rise to the Black Lives Matter movement and the civil unrest occurring around the country weigh heavily on our hearts and minds. And the coronavirus pandemic, in the space of a few short months, this pandemic has forced us to make dramatic changes in our lives, in how we work, how we communicate, educate, and graduate, how we spend time with our friends and loved ones, and how we connect despite being disconnected. That's why I feel so grateful to LERA and to all of you for finding the way to come together in these highly unusual times to attend to the important business at hand. It is nothing short of phenomenal that we've been able to pull this off. Thank you, Emily and Bernadette, and everyone else who helped make this possible. You all have been wonderful. So, given the events of the last few months, I'd like to start today with my deepest gratitude to the thousands of healthcare workers out there who are assisting patients and saving lives. What they are doing is superhuman, so I'd like to share this wonderful short video message of appreciation. Again, a deep and heartfelt thanks to all those on the front line making our lives better. I must say, it's hard to make a transition away from those Herculean efforts. But what I would like to talk about today is something that I think has helped Kaiser Permanente rise to the occasion during this pandemic. I'd like to make the case why I believe an interest-based partnership approach is the best model for management and labor. And I'll go back to the early days of my labor relations career to explain. Unlike most of you, management chose me for this work by seemingly taking out a magic wand and dubbing me as labor relations. Next thing I knew, I found myself sitting in the labor relations department of a large automobile parts manufacturing plant in Detroit, Michigan. I had zero training or understanding of this field, but little did I know, the School of Hard Knocks was patiently waiting to teach me. So there I was, a labor relations guy. One day I'm at my desk and the phone rings. Ring, ring, and I'm summoned to the press shop, where the sound of the automotive presses was so loud it made it difficult to even hear yourself think. Let me say, these presses were big, 3 stories tall, lined in rows of 10, with 5 to 8 presses in each row. It was where we made things like an extended 13-foot Chrysler van roof. Whenever I had to go in there, I always braced myself because it was so loud and big. Anyways, I go in and the first thing I noticed was that it was eerily quiet. And that was very odd. I looked around and I saw a manager and a union representative standing at a lead press with their arms folded, facing off. All the employees had stopped working and they all were just watching the 2 men. Not knowing what to do in this situation, my labor relations instincts kicked in. I invited the 2 into an office to talk. They both readily agreed, and as we walked off, I could hear the presses beginning to run in the background. And that was a good sign. But I still had no idea how I was going to resolve the dispute. Luckily, when we got to the office, I didn't need to say a word. That's because these 2 guys began talking and apologizing to each other for putting each other in this situation. Back in the shop, they couldn't communicate because they were using an old script. A script that said that they couldn't back down in front of the employees, that they had to be strong and uncompromising. But once they got into my office, they were able to talk, and most importantly, listen to each other. It was an important thing for me to see. This was my first glimpse of seeing management and labor working together. And over the years, I have been witness to countless situations like this, where management and labor have worked together to find creative solutions to vexing issues, where they have produced quality products and where they provided a voice and security for workers. These experiences have been invaluable and have helped to make me who I am today. And over the years, I've furthered my education in labor relations through classes at Cornell, Michigan, Harvard, and other prominent schools. I've had the added privilege of working with some of the finest university professors in the country, like Joel Crutcher Gershenfeld at Brandeis, Thomas Kochen at MIT, and Harry Katz at Cornell. In addition, I've worked with some great folks at the FMCS. As I'm sure Jimmy, Scott, Linda, and Javier will tell you, there are just too many to name. And yet, firsthand experience has always been the best teacher. The second story I want to share came later in my career. Just when I was feeling ready to make my mark in the field of labor relations, I was part of a team that hosted representatives from the United Auto Workers for an important bargaining session. And I felt good going in. I thought I was bringing everything I had to this session. Unfortunately, I forgot my common sense and humility. So, I remember feeling pretty good when the union really listened to our first set of demands. And yes, they were demands. And then they asked legitimate, probing questions. It felt like we were going places. But then a great person and UAW leader Herb Wilbur, pulled me aside and said, "Dennis, I noticed you guys had a full spread buffet in your caucus room. Coffee, donuts, fruit, the works." Then he noted the same was not true for the Union caucus room, which was supplied only with pitchers of water. He made the point that as hosts, we clearly were not treating them as equals. The lesson here was not about the coffee or the donuts. Well, truth be told, I would like to talk about those donuts, especially the voodoo donuts in Portland that we are currently missing. What I learned at that UAW session was not just about treating others as you want to be treated, which is monumental, but I learned about the importance of relationships and bargaining, and about the importance of trust, integrity, and being a person of your word. It was a formative experience for me in terms of how I see myself and my work. One last story. This one is from later in my career. After I moved on to the utility industry, working with excellent union leaders like Mike Langford from the Utility Workers Union and Jim Hunter from the IBEW. It was during this time in my career that I learned more about interest-based bargaining and a facilitated process. One day, we're at the bargaining table, negotiating over what else? Benefits. We had an interest on the table that employees participate in the cost of health benefits. A union representative asked the company in a not so pleasant way, how much money did we want employees to give from their paychecks? We all agreed this was an excellent question. Days later, we settled for much less than the 5% originally asked for. For me, that solution brought an end to days of arguing over expenses of healthcare. It became clear to me that interest-based conversation can deliver better outcomes for all parties involved. Another important lesson learned. All of these lessons continue to inform my current work in healthcare, and more specifically with labor management partnerships, which I think are a better, or shall I say, superior approach to labor relations. Before I explain why, I just want to say that partnership is not utopia. It brings its own crazy, unique challenges. But I do believe the challenges that partnership presents are in the end truly worth the trouble. Because partnership at its core expands the opportunities for developing strong and long-lasting relationships between labor and management. So, what is it about partnership that fuels its success? The cornerstone of a great partnership is teams, employees working together to achieve better performance, quality, and customer satisfaction. They improve the work environment. I'm going to show you a video featuring one of our unit-based teams. They bring together frontline employees with managers and physicians to innovate and improve performance throughout our organization. These teams represent the essence of partnership.
Just by simply striking up a conversation has now had a $1 million effect, essentially. Our UET team consists of assistants, technicians, and pharmacists. Our challenge was that our inventory had risen to $3.6 million. At that point, we realized that we needed to do something to reduce it to help save money for the San Diego area. We noticed that a lot of our cost was in very expensive medications, hepatitis C and antiviral medications. We realized that we had professionals in this area. So it was hunting down our ambulatory pharmacists, developing some relationships and asking them what they were seeing.
Having the relationship with outpatient pharmacy and the inventory control assistant has been great to manage my patients, because with the tight communications we have, we will be able to locate where the medication will be, so the patient has a good expectation where and when to pick up the medications.
We were able to drastically reduce our pharmacy inventory with those drugs, but also optimize it to make sure that we had just the right amount to be able to serve our patients. In addition, it ended up being a safety project. So instead of opening 30 small bottles, we're opening 1 large bottle.
It saves pretty much a lot of twisting and turning of the bottles. I mean, your wrists will love you. I can tell you that right now, because we have pharmacist technicians that say, hey, this is a great idea. Why didn't we think about this a long time ago?
The team featured in that video is one of more than 3,600 unit-based teams working across Kaiser Permanente. They drive efforts to continually improve the care we provide to our 12.3 million members, and to also improve the workplace experience of our tens of thousands of employees. The work of our UBTs affects virtually every aspect of our business. We have teams engaged in continuous improvement and innovation, not only in clinical settings, in our emergency departments, maternity, pharmacy, pediatrics, and oncology units, but also in support settings, from food and nutrition services to our housekeeping and janitorial staff. And they clearly are making a difference. We evaluate how well our teams are working on a regular basis. That information, combined with quarterly surveys of Kaiser Permanente employees, provides strong evidence of the positive impact the UBTs have. The surveys show that employees who are closely involved in UBT work have significantly better scores in response to questions about their health and overall well-being. They are also much more likely to feel they have a voice in making important decisions about their work and feel they can speak up safely on the job. This is an extremely important point, as it ties directly to patient safety. Departments with high-performing UBTs also have fewer workplace injuries, they have fewer lost work days, and they see improved patient satisfaction. From my perspective, interest-based partnership helps to achieve superior outcomes for everybody: the employer, the employees, and the unions. Partnership brings together diverse points of view, which can only lead to better decisions. This approach requires daily collaboration between labor and management. Sometimes the process is frustrating, but the frequent collaboration builds trust. And it fosters a collective belief that it's possible for labor and management to both win. Again, it doesn't guarantee labor management harmony. The differences between labor and management are inevitable, especially during bargaining. But my many years in this business have convinced me that it is important to let your shared interests define the relationship and not the differences. My experience in partnership has shown me that it's possible to develop labor management relationships that are about much more than simply who gets a larger slice of the pie. That's just old school thinking. Kaiser Permanente has seen continuous improvement in service, quality, and performance. At a time when union membership has declined in the United States, our partnership unions have seen their membership almost double in the last 2 decades, and our workers consistently receive leading wages and benefits, commitments to job security, and a powerful voice in key decisions. The success of our teams reflects the truth about labor management relationships that I've learned early in my career. The partnership approach we pursue is a better way to go. Not easy, but better. I will end today with a quote from our former CEO, Bernard Tyson, who suddenly passed away in November of last year, and whose support for our partnership was unrelenting. He said, "Our labor management partnership has helped make Kaiser Permanente a better place to get care and a better place to work. It has made Kaiser Permanente and its workforce strong, set us apart, and given KP a unique competitive advantage. Maybe it can do the same for your organization." With that, I want to remind you all to stay safe, stay healthy, practice social distancing, wash your hands, and wear a mask. Thank you.